mindset?
I have to say my little ones, because they're watching. So, I have to be mindful of the fact that they're watching. They need to see mommy, get it together and get out the door. So that's my motivation on those days where, it's a little bit difficult to get going, or I feel like, oh, I don't feel like doing this today, which I have to say, with the training piece of what I do, it's rare that I say, I don't feel like doing this today, because I have such a ball when I get there and I get in the classroom. I have so much fun.
If there's a cause you strongly believe in, what would it be?
I'd say, education and educating the at-risk youth, at-risk population. I think that's so key. I think that in working in that field, what I found was students, and I'm going to say that students were thrown away. So students were basically told that you can't do it, you won't do it, you won't succeed. So working in that field was so important, and I encourage anyone who's looking and thinking about going into education to think about that population, because they were wonderful. And yes, we had our challenging days, and yes, we had our tough moments, but the reality was that was the most rewarding experience, to be able to pour into those lives and see the fruit of our labor.
You mentioned opening a book and reading as a form of improving oneself. You've written a book yourself. I want to take you somewhere hypothetical. If you had to go to a favorite place to relax and take your favorite book, your favorite drink, your favorite music, where would this place be? What would you be reading? What music will you be listening to?
Oh my. So this isn't too hard, actually.
And what would you be drinking? I forgot that one.
Okay, so I would, you're going to laugh at all of my answers. So I would be on the beach by myself.
By yourself?
Yes, by myself on the beach, drinking Welch's white grape juice. It's my favorite. What would I be reading? Well, you're going to think that I'm just saying this, but I want to read your book. And I started reading it. Yes, I started reading it today, and I want to read that. As I'm going through, I'm getting a copy before I leave today.
Thank you.
But something inspiration, something motivational. I wouldn't be reading anything that would be too hard to swallow or to digest. So it would have to be something that were motivational, uplifting. A book of Nikki Giovanni poems might be it. So it would be something uplifting and inspirational. And what would I be listening to? I would be listening to Jill Scott.
Jill Scott?
Yes.
Oh, one of my favorites too. When are you most happy?
When I'm doing what I love.
What are you most thankful for?
My family.
Ah. What advice would you give to young people considering going into business for themselves?
I would strongly encourage them to do their homework. And absolutely, yes, do your homework, research, whatever it is you're looking to go into business for. And how do you do your homework? It's not just about reading, which is important, but it's not just about reading. It's getting in touch with people who are doing what you're interested in doing and having a conversation, asking them to maybe mentor you or even sponsor you, depending on who that person might be. And then I would encourage them I'm going back to what I said before about self-assessment. I would encourage them to assess what are the things that they're good at that would enable them to be successful in that particular endeavor. So taking a look at the strengths and what strengths they could bring to that, but also looking at what lies in the gap. So this is where I am. This is where I'd like to be. What do I need? Is it additional education? Is it more experience? What is it that I'm missing? So I would encourage them to do those two things. Figure out what's missing by self-assessing, but also talk to someone who's doing what it is they're interested in doing.
If you could go back in time, what would you tell your 15-year-old self?
Why are these questions funny to me? My 15-year-old self, I would say, what's interesting? That whole take advantage of opportunity piece, which we talked about we talked about before, that's been what I've used to encourage other young people taking advantage. So I would say, just be open. I would tell myself, be open, be open to the possibilities, because there's so many opportunities out there. There's so many possibilities, and you don't want to limit yourself.
Last question.
Okay.
What makes you laugh out loud?
I'm funny, so I'm just thinking. Sometimes I make myself laugh, but I think I was talking about my husband before, and we just spend so much time just laughing. So sometimes I'll just be driving along, and I'll think about something funny that's happened at home, and I will start laughing. I will. So I think it's those things. I think it's those personal moments, those the inside jokes. Those are the things that make me laugh out loud.
Thank you so much, Kimberly, for sharing your time with us and sharing us so many pearls of wisdom. And I hope I was able to twist this gem a little bit and expose the various facets of Kimberly Ferguson. Thank you so much. I'm looking forward to reading your book, and I'm looking forward to your next visit to CWS. Perhaps CWS as it is on Sunday afternoons, where you can speak on something specific.
Nice.
All right.
Well, thank you.
You're welcome. Good night. And this is Selvin Collins saying, thanks for listening. Good night. Fear not what fear whispers to you. Fear your obedience to it.
And be creative.
We're back to the lovely Lauren. Lauren, what are most people surprised to learn about you when they get to know you?
What are most? You have to ask them. I don't know.
Oh, okay. Let me phrase it this way then.
Okay.
What is one thing about you believe that might surprise people to know about?
To know about me. That didn't make it easier. What's funny? I think. What's something that people learn about me that surprises them?
Or you think might surprise them?
Sometimes I'm really funny.
I think I should get off camera.
Sometimes I'm really funny. I'm like a quirky kind of funny though. I'm just kind of like out of nowhere kind of funny.
How do you define beauty?
Oh wow. Beauty, beauty for me is always from the inside out. So it's really more about who you are, how you treat other people, and that's what makes you beautiful.
What would you say you've learned about yourself over the lifespan through the lifespan of your career?
I only have patience for certain things. Like I'm a very patient, kind and patient person, I was raised well. But, sometimes I don't have, I was saying something earlier, I'm a very realistic person,
Okay.
So I don't have space for insincerity, and then something else not recently, but I've let go of what other people think of me or how they see me or worrying about other people think of me, So this idea of being shamed for something you did or didn't do, kind of thing. Like, life is too short, like we all have stuff to work on.
You mentioned your grandmother, what an impact she had on you. Your mom. You mentioned the ancestors. When things are not going right for you, when the challenges are overwhelming, who are you listening to? Who are you channeling during those times?
Wow. When things aren't going right.
Yes.
You know,
Who's in your head? Whose voice you listen
definitely
to?
my family.
Your father.
My family, you know. I hear my mom saying, "Are you happy?" Because she asks me all the time, "Are you happy?"
Are you happy now, Laura?
I am. I am. I am. It's very important. It's been a guiding light, you know, because it makes me listen to my spirit when I ask that question, you know. And then my dad, my dad is very, you know, he would say things like, "Well, we taught you everything you need to know. Go ahead, we taught you everything you need to know."
Sound wisdom. When are you most happy?
When I'm dancing. Yeah, it could be anything. It could be in a dance class. It could be a performance. It could be just playing around in the living room. It's, yeah, when I'm dancing.
What are you most thankful for?
Wow, so much I'm thankful for.
Only one more.
Only one?
Yes. Okay, give us two then.
What am I most thankful for? Love and life.
I like that. Love and life. Where do you draw your inspiration?
Wow.
If you had to choreograph
Yeah.
the dance, I'm not going to say of your life, but if you had to choreograph a special dance, where would you go to for inspiration?
Charles, of course.
Yeah, poor Charles.
I know. He's gonna be like,
Oh.
I mean, he. It's funny because, you know, he's known me half my life. You know, maybe even more than half. But and so, yeah, like he knows so much about me, and I know so much about myself because of him and relationships with other people. You know, it's just probably Charles.
Something that happened to her 10 years ago or 20 years ago, which I think is important so she can at least know for her own self and also teach others to avoid these pitfalls.
Mm-hmm. And what tests and screenings do a woman need each year, and how often should she get a pap smear?
Well, I still recommend the pap smear every year, but the American College of Acupuncture and the American Medical Association, they're kind of pushing to have pap smears every 3 and sometimes every 5 years. Mm-hmm. I see some wisdom in that if a woman has been having normal pap smear all along, chances of her just developing cancer in the next year is not likely. But what I like about having women come in evaluated, see, when I see my patients, I don't just do a gynecologic exam. A lot of women don't have a physical exam. A lot of women don't have a medical doctor. So when they come to me, for example, and a few other GYN doctors, we do a full physical exam. You know, I can still pick up heart murmurs, even though I'm supposed to be working below the waist.
Right.
I can still pick up heart murmurs. I can pick up problem with the liver. I can pick up problem if their eyes look kind of strange. Maybe they're having something with their gallbladder, or they're having some kind of anemia. There's so many things we can do for a patient if she comes in every year. So I still recommend every year for the physical exam, but they come in for their pap smear, so to speak, and I do their pap smear. But even if it were for the pap smear, I think somebody should be in contact with a medical professional at least once a year.
How do you, well, someone asked me to ask you this question, how do you treat uterine fibroids? Is that a fair question?
That's a fair question, especially for me, and that's one of my main work that I do. Because uterine fibroids affect a lot of women, especially black women. Okay, we don't know the exact reason, but maybe it has to do with diet, food. You know, a lot of the foods are kind of laced with hormonal stuff, and the hormones tend to trigger the growth of fibroids. But officially, the answer to that is we don't know why fibroids come about. But when they do come about, the management of fibroids often has to do with the woman's, I wouldn't say age, it's the woman's desire for childbearing, the way you manage those fibroids. Because a lot of people just do a hysterectomy right away for fibroids. But I was trained a little differently to be conservative and try to save the uterus. And so I do what's called a myomectomy instead of a hysterectomy. And the myomectomy means you're removing the myomas. Each fibroid, the other medical name for it is myoma. So I do myomectomy. And you do a myomectomy in a very conservative way so that you can preserve the woman's uterus for the possibility of childbearing. Some women just do not even want to have another child, but the fact still remains, if you're going to do a myomectomy, you have to do it well, so that the woman's uterus, the integrity of the woman's uterus is kind of intact. So whether or not she wants to have a child, she has an intact uterus that's put together nicely and sits in her abdomen really well and not cause her pain and discomfort along the way.
Talking about childbearing, how are abortions on a woman's body?
Abortions, there are different types of abortions. You have the abortions, but in the medical world, we call miscarriages. The medical word for it is abortion, meaning you have aborted.
Yes.
But the regular world think of abortion as something you wish on yourself. Right? So an abortion, or what we call a voluntary abortion, voluntary termination of pregnancy, can take many forms, because you can have an abortion very early, 6 weeks, 4 weeks, once you find out you're pregnant. And a lot of times those abortions have very little impact on the body. But I hasten to correct that by saying it depends on who does these abortions. Because if it's not in the hands of somebody who really know what they're doing, then they can cause havoc on the woman's uterus. When you go in that cavity of the uterus to take out that fetus, you could create scarring. So if you're having an abortion, you should go to somebody who really is proficient at it. And then you have abortions at different levels of pregnancy. You have the abortion where you can just go in and use what they call a curette, and you remove or suction the poop. Should we go on?
Sorry?
Should we go on?
Yes.
People get turned up.
No, I mean...
you can suction out the fetus, or you can, if it's older, then you can have a procedure where the patient, you sort of initiate a spontaneous abortion where the woman expels the fetus.
Do you have any advice for women who are pregnant?
Well, in general, pregnancy can go from 1 week to 9 months. So in that whole sphere of pregnancy, the most important thing is to take good care of yourself. Because for the time being, you are the home where this fetus is going to live. So if you have a baby inside you and you're smoking and you're drinking and you're cursing and swearing and you have bad thoughts, then all those things affect the fetus. If you have negativity, stress, worry a lot, it affects your baby. Everything affects the baby.
You mentioned negativity and energy and thoughts,
Absolutely.
and I am drawn to that other aspect of your profession, acupuncture and traditional Chinese medicine. Who in your family, if any, was involved in healthcare, and was your mother or grandmother a healer?
my grandmother's father, from what I understand, was a doctor. He used to deliver babies, but I never did get to explore it because I found out so late. But I know the medical. There are few people in my family who are medical people. There's some younger people in Jamaica that I have found out from my father's side who are physicians, and from my mother's side. And people, I'm a formally trained doctor, but when you look way back, people are always trying to heal. So I grew up with a grandmother who was always picking the bush and rubbing it on and healing. So that can be in the blood too.
I want to ask you a question because I want to create a sort of bridge between your practice of Western medicine and Eastern medicine.
Okay.
But I would like to give you the opportunity to introduce us to your upbringing and what you might have been exposed to while being raised in the Caribbean and Jamaica specifically. Tell us some things that you might have witnessed, might have observed, might have been exposed to that led you to believe that there are alternatives.
Yes, you're from the Caribbean, I'm from the Caribbean. We all know alternatives. We all know that there are people in our family that would cure us from certain things without taking us to the doctor. We know that.
Yes.
And so, as I said, when you're a child, you don't even know how much you're absorbing. But I do recall as a young girl, when I was in high school, that I used to be fascinated with the other aspect of medicine. Because a lot of medicine, Western medicine, still to this day, come from herbs. A lot of the chemotherapies come from plants. A lot. Because the drug companies make it sound so fancy. But tamoxifen, which is one of our modern chemotherapy drugs, is a herbal medicine. Vincristine, vinblastine, these are big time, very expensive chemotherapy, come from periwinkle. Penicillin came from, mushroom. It's very old stuff. So, but as a child, I remember I used to try to sneak into the University of the West Indies with my friend. We used to go in, and she did literature, my friend Barbara, which she could be listening, and she was always into her literature. And then I would go to the university with her when she used to go and study Shakespeare and those things, and I would sneak down to the science library, and then I would borrow these books. Maybe they thought I was a student. I would borrow these books, and I would take them home and study plants. And I can't believe this. Plant can do that, and I was very fascinated with that. But these are things I kept to myself, My mother knew that I was always borrowing these books, and she'd take the people's book back. What are you doing with this book, But I was very thrilled by the fact that plants can do so much. So one thing kind of led to another, where I started to study and look into Chinese herbs, and then I was fascinated with ginseng, white ginseng, and all these things. And then I came across a company that does Chinese medicine, and so I joined up with them. Many years now I've been working with this company, and we do a lot of herbs, pure authentic Chinese herbs, and then I guess getting involved in that level of Chinese medicine, I was fascinated by acupuncture. Acupuncture is another very long story. We wouldn't have time for this show. But
You'll be coming back, so that's fine.
I happened up on acupuncture, and one thing to another, I went to China and got to see a little more of what they do, and I was just amazed. It was just the most amazing thing to see. Stroke patients just walking out, it was something to see. I say I'm sold. So since then I've been doing acupuncture, which is like over 20 years.
Over 20 years. Let me just go to the chat room for a second. G asked, are you a proponent of the HPV vaccine? If so, why?
Well, very, very, very good question. I have not really advocated for it,
Mhm.
um, only because I'm not too sure about it. I won't say too much, but I have not really advocated for it. The HPV is a very dangerous virus, so it's something where if it's explained to the person and they want to take the vaccination, then there's some amount of wisdom in doing that
Okay.
as a prevention if you're really sexually active.
And Callie said, Dr. Martin, thank you for being on the program. What types of ailments would acupuncture be better suited as a therapy?
Well, in this side of the world, the Western world, they think of acupuncture as something for pain, and it's wonderful for pain. But when you really study acupuncture, for example, I was in China, central China, and we worked in a clinic near the University of Chengdu, and they literally treat almost everything: high blood pressure, heart disease, diabetes. And here I do some acupuncture for other things. When I do acupuncture, I don't just treat pain. So the standard thing that most people know is the joint pains, the headaches, the migraine. Acupuncture is just remarkable for that.
Mhm.
But there's certain other diseases that acupuncture works very well for.
And Callie asked, which cultures do you admire for how they practice medicine?
Wow, very interesting.
I have an interesting audience here.
Yes, that's very interesting. Yes. Well, I'm a little biased, but I admire the China. Well, obviously, I'm trained here, so I
Yes.
admire Western medicine. It when practiced well, it is really fascinating and interesting, and can be very deep in terms of the knowledge.
Mhm.
Some aspects of it, however, are abused. But what I admire about the Chinese is how they believe that the body can really cure itself. I find that in Western medicine, I have to say we, because I'm a Western doctor, we jump a lot to take things out and fix things. I mean, for emergencies, you can understand, but the body doesn't get a chance to sometimes heal itself. A lot of heavy drugs are given to people, and these drugs cause side effects. And the drug companies, they wait and then they tell you, oh, this would cause a side effects, but that's like years after the drug is out there. People are not told when the drug comes out that this could cause this or this could cause that. So unfortunately, people experience the side effects and then there's a recall or whatever. So I admire the fact that the Chinese embrace a lot of Western medicine, mind you, because when I was there, across the street was a Western hospital. So they really embrace Western medicine,
Mhm.
but they believe in combining them. And the Chinese people, they embrace it, and it was very interesting to watch them leave from the Western side hospital to come over to us on the Chinese side to get another opinion on it.
But how did you become involved with weaving traditional Chinese medicine into, or natural traditional Chinese medicine into Western medicine?
How did I?
How did you get involved into weaving the two?
Oh, okay, combining the two.
Mm-hmm.
Well, because it makes so much sense, you know. When I went into medicine, and every doctor, I hope, go into medicine to make people feel better. So it's very simple. Um, One medicine alone sometimes doesn't do the trick. And so, for example, if I have a patient coming to me and she's suffering from, let's say, endometriosis, which I don't know if you know that disease, very painful disease, and you're going to admit the patient to the hospital to do laparoscopy or abdominal surgery in another day or two. I do acupuncture on the woman, and she gets to go home, relax, talk to her family, pack her bag, and come to the hospital the next 2 days. Whereas when the patient is doubling over in pain, you have to send her to the hospital in an ambulance. So I get to quiet the pain And then I still do my Western thing.
Hmm. G asked, how do you use Chinese herbs in your practice? Is there an herb that is useful for, say, HPV?
Well, I work with there's a company I work with, and the herbs they have, they're traditional Chinese medicine, but they're packaged kind of Western looking. They're in caplet forms and capsule forms. And there are numerous herbs. You know, we have all the different ginsengs, we have the different tonics, we have the herbs that work for the joints, we have the herbs that work for diabetes, and we have teas that clean the blood and clean the system. And so it's very, it's packaged really nicely, and patients get to go home and open them. It's not almost like they're dealing with Western medicine, but it's not. And I give them the instructions, and it's been many years of that, and they all seem happy. We have multivitamins. A lot of people don't nourish their bodies well, so a very wonderful multivitamins that addresses different aspects of the body's needs. Like minerals and stuff that are missing that you don't get from our regular food.
How do you deal with patients who doubt the effectiveness of acupuncture?
Well, how do I deal with them in terms of how I approach? I don't argue about acupuncture. Acupuncture is 5,000 years old. So I don't argue. If anybody doesn't believe, I don't know, I would know where to start. I would try to educate them. But you don't argue with something that's 5,000 years old and still going on.
I want to ask you this question and take a quick break.
Yes, sir.
What are some common fears and myths about acupuncture?
Well, the fears that people obviously have with the needles. I'm being stuck by a needle. But if it's any consolation, it's not like the needle that's used to draw blood. It's a very tiny, in fact, we refer to it as filamentous. That means it's like a little filament of a needle. And because it's so tiny, when the needle is going in, most people really don't feel it. They feel a sensation because there's a sensation which we call the chi. And that sensation is really almost like a reassurance for the doctor doing it that, yes, I'm in the right spot. That's really what that means to the doctor, even though the patient might say, ouch, So it's a lot of fun for me, and patients get a lot of good results, and they seem to love it. So.
Let's take a quick break.
Yes, sir.
I act, sing, and dance. I feel that is what I'm here to do. I feel that's my gift. It's something I'm really passionate about. I think it's important that you pursue your passions, whatever they might be in life. And sometimes passions can change. What might be a passion for a 5 or 10 year period may morph into something else. But those things have been pretty consistent in my life. And in particular, dance. I started out, dance was my first love and first real interest and entree into the performing arts world was via dance.
What does the name Adeshola mean?
Ade means the crown brings us wealth.
Wow. Wow. If there is one, how would you describe the connection between your dancing and freedom?
There definitely is a connection. I feel dance is one of the most powerful ways to express yourself. It's something, again, that my parents did. My mom danced, my father and uncles. I had an African dance company called Africa One Dance Theater. So I was raised around dance. I think it allows people to express themselves in a way that sometimes talking and even singing don't, because you're using your body, when in the other forms you are primarily using your voice. So I think dance is really liberating, and I know a lot of my friends and I have often said when there are difficult times or things are stressing you out, there's nothing like going out to a club or just going into a rehearsal room and just moving. Just getting your body going.
Try not to swing.
Okay.
And just come up some more.
Come on.
Yeah.
There we go.
So where were you born, and what was life like for you at the age of 9 and 16?
I'm a native New Yorker. So I was born in New York. At 9, I would say it was pretty regular in terms of going to school. I was very active in sports. I love sports, basketball, baseball, football, boxing. So I was your pretty regular young child, growing up in New York, being active. My mom and grandmom and father were always artists and artistic people. So I think from an early age I had a love and real respect for the arts. 16, let's see, it was high school. So 16, I think at that time I was a little more serious. I was in high school. I went to high school in New York City called Columbia Prep, which was a very prestigious, a little bit of a high level private school. So the workload was really hard. I was going to school with different kids than I had gone to school with from my earlier years. So it was kind of a learning curve socially, meeting different people. Very much into sports. I played in the basketball team, played in the baseball team. I first started really viewing and looking at dance as something serious probably around that time. So, popping, waving, electric boogie, things like that.
So who would you say you became at age 21?
I became a person I'm still working on. Just again, I knew that I wanted to perform. I wasn't exactly sure which direction that would go, whether it was dance solely or acting. I was, messing around with some singing and some rapping. So I knew that I wanted to continue performing and getting better in whatever discipline that would take.
You mentioned your parents being artists and being part of a dance troupe and your uncles and so on. How would you characterize your upbringing? Were you always encouraged to follow your interests?
Absolutely, absolutely. Like I said, my mom performed, my dad and uncles performed. So there was a very much an artistic, entrepreneurial spirit.
Right.
My parents are from Jamaica and St. Thomas. So my grandmother was your traditional West Indian, hardworking, oldest of 11 brothers and sisters, right? So whatever I wanted to do, I feel I had some freedom. It wasn't like I could run around and do anything, right? Because that wasn't ever going to happen. But I had some freedom to do what I wanted to do, and I had to be serious about it. So if I wanted to do my dancing or go and play sports, I could do that, but was my homework done? Was it done well? Whatever chores might have needed to be done, were those taken care of? Then after that, I had my own time.
So your parents were disciplinarians in a sense?
Yeah, I'd say that.
I want to fast forward a little bit. Now, I'm trying to spend some time in your early timeline to get a gist of who you are, but I want to fast forward because you just give me an opportunity to do so. As an actor or on stage dancing, coming from parents or having parents who dance and are pretty much professionals, what was that like? Was there critique? Well, how did that relationship? What was that relationship like?
That's a funny story.